everyone. For those of you who don't know me, my name is Laura and I am the Darton Association of Nursing Students president. I wanted to share my personal story as to why we got Dan so involved with the Cystic Fibrosis Foundation's Great Strides Walk. I have two girls, and this is, I don't know if you can really see it, a picture of my family. The littlest one is Riley. A week after Riley was born, we received a phone call from her pediatrician's office stating that we needed to come in the next morning because her newborn screen had come back abnormal. So of course I was like, what's wrong? Is everything okay? And they said, you just need to come in and talk to the doctor. So we were on our way to Fort Benning, turned around, went to the pediatrician's office, and the pediatrician that was there, Dr. Evans, told us that Riley had cystic fibrosis and that she would only live until she was about 35 to 40 years old. We found out that day, and this is about, like I said, a week after she was born, and he showed my husband the results showing that she had one gene that was normal and one gene that was mutated. But in Southwest Georgia, especially in the Albany area, people don't know a lot about cystic fibrosis, so they automatically assume that that is what she had. We went to MCG about a week or two later, and they explained to us that Riley has the genetic mutation that causes what is called cystic fibrosis related metabolic syndrome, or CRMS, and that she may never develop symptoms of cystic fibrosis if she avoids triggers, or she could develop mild symptoms, moderate symptoms, severe symptoms, that there wasn't enough research to really know at that point in time, but that she would have to have continuous monitoring throughout her life. So if you don't know where Albany, Georgia is, it is in Southwest Georgia, between, like, in the corner by Alabama and Florida. To get to Augusta, it takes about 5 hours. So if you are driving in a car with an infant or a toddler, if you have kids, you know that that is very, very hard to do. Every 2 months, she had to go up and get tested for a throat culture. She had to have sweat chloride tests. Every 2 to 3 months, we were constantly traveling up there for the first close to a year and a half. And so that's very draining financially, emotionally. It's scary. You worry about every last little thing that they do. You try to give them a normal life, but you feel like you can't even send them to something as simple as daycare or family member's house because you're afraid that a trigger is going to start the cystic fibrosis exacerbation and cause her to have that for the rest of her life. Many parents who have children with cystic fibrosis, they have to go through chest physiotherapy 3 to 4 times a day with compression vests. The treatments are very, very expensive. The travel is expensive. They have to have the pancreatic enzymes, which sometimes insurance doesn't cover. Some of the medications aren't covered, the bronchodilators, things like that. So I can only imagine how those parents feel having to make that trip, and then when their children do have exacerbations or go into a crisis, those kids don't go to a hospital for a day or two. They go for a week or longer, sometimes even up to a month, depending on how bad it is. Riley has recently developed some symptoms that we are awaiting testing on. But a recent situation that happened with us is my husband didn't know, and Riley developed what is called steatorrhea, or a fatty stool. So I discovered it when I was changing her one day, and I immediately freaked out because that's what parents do when your kid develops a symptom of a disease that that they carry. I called MCG the very next day. They said, well, we're 5 hours away. You can make an appointment and drive up here if you would like, but we suggest you call your local pediatrician. I called the local pediatrician's office, and not her not her normal pediatrician, but one of the other pediatricians on call, returned my phone call and said, well, they go on some kind of enzyme, they get some kind of treatment, I'm not really sure, what we're supposed to do for her or what you want us to do for her. So as a nursing student, I had to explain to the physician that she needs to be seen, she needs to have her labs drawn, she needs to have her stool sampled, sent to the Mayo Clinic. She may need pancreatic enzymes, but you guys need to look at her and determine if that's the issue. So there's not enough education in this area for pediatricians or sometimes even nurses. There's no specialist for us to call. There's not many options for parents who have children with cystic fibrosis or CRMS and other related disorders, because there's several different mutations that children can carry, and some are worse than others. So that's why Dan's is getting involved with the Cystic Fibrosis Foundation's Great Strides Walk and working so hard to try to get donations and get people to join our team. Being in this area has really kind of opened our eyes, especially with my family, to that. We come from a larger area where there is a cystic fibrosis center. But here, families don't have much of an option. There's not much that they can do. The medical staff in the area are undereducated on the disease. They don't know a lot about it. They don't know how to treat it. The centers for these patients are very far away. The closest to Albany is Atlanta, or you can go to MCG in Augusta. So this is, very financially draining on families to have to do, to keep their kids healthy and to give them a long life. So the Great Strides Walk in Albany is April 12th, 2014. We are encouraging as many people to donate on behalf of the Darton Association of Nursing Students. Join our team. You don't have to be a nursing student to join. Family, friends, co-workers, whoever can join our team by going to the Cystic Fibrosis Foundation website, clicking on Great Strides, clicking on Teams, and searching our team, which is the Darton Association of Nursing Students. Most people don't realize how serious this disorder is, and that these kids have to go through so many treatment regimens daily. And as nursing students, we want to try to reach out to these families and show them that we care, do what we can to help them get to their appointments, help them get their medications, be advocates, which is, one of the ethics of nursing is being an advocate. Sharing this story is really hard, and I'm actually surprised that I haven't broken down and started crying, because, it has been very hard on us the last year, especially with me being in school, having to travel up to MCG every 2 to 3 months, watching your child go through a barium swallow, having to administer the barium because you've got 4 people holding her down and nobody else can do it. Having them go through the sweat chloride test, they hate it. It's exhausting on the child. It's draining on the parents. So I'm not asking you to put yourself in my shoes in any way, shape, or form, but put yourself in the shoes of a parent who would have to do chest physiotherapy to their child 3 to 4 times a day, and make sure that they get their pancreatic enzymes, before each meal. Not being able to send them to daycare, not being able to put them around certain family members because maybe they smoke, administering bronchodilators, nebulizer treatments. All of these things are what parents have to go through on a daily basis. So if you have children, imagine what that would be like for you. So we ask for you to join us and really think about what the awareness that needs to be brought to this area and ways to help these families out. Thank you.